Hello, my name's Gill Dickinson. I live in Edgeley and I've had type 1 diabetes since my mid-30s, so I've had it a couple of decades now. And despite the fact that I've worked in health promotion and public health for a good number of years, and I feel that I'm quite well genned up on food, physical activity, the evidence base around, prevention and looking after yourself. I've still really struggled with my diabetes, despite the fact that everybody looks at me and thinks, oh, Gill, she practices what she preaches, she's really healthy, she cycles everywhere, she does loads of physical activity, she's a bit kind of precious about what food she puts into her body, but I've still struggled. And my HbA1c results aren't brilliant, and I think a lot of it is to do with the fact that I do different types of physical activity of various intensities, and sometimes I just get on this roller coaster with my blood glucose levels and I just cannot stabilise them. So it does make me sometimes feel like throwing the towel in quite a lot. Okay, so I've always had really good support at my GPs around my diabetes, and Viv Hallows, the practice nurse, is really excellent there. And she referred me on to the diabetes nurse specialists, and I've been seeing Rona for a couple of months there, and then she referred me on to the type 1 diabetes education course, which is called SOCCA in Stockport, and it's based on Daphne. Before I went on it, I thought 4 days, it was 1 day a week for 4 weeks. I thought, how can I possibly feel 4 days finding out about diabetes when I know so much anyway? So it was a real leap of faith, taking 4 days off work, going on it, and then there was a half-day follow-up 3 months later on. So yes, I went on the course, and basically I haven't looked back since. The course is a very practical course. It teaches you better self-care. So it focused on two main things, just purely carbohydrate counting, and then how to adjust your insulin doses in line with what patterns you saw in your blood glucose levels. And like in the past, if I had problems with my blood glucose levels, I'd speak to Viv about it, and then she'd suggest something and I'd try it for a few months and it either would or wouldn't work, and but now I know what to do. I don't need to ask Viv, I don't need to phone up and speak to the diabetes nurse specialist. I know what I'm looking for and I know what to do. So whether it's to do with when I'm ill and I've got high ketones, whether it's to do with fatty meals, which are quite difficult to adjust your dose so that it doesn't have too much of an impact, or whether it's to do with intense physical activity, like sometimes I can be jiving for like 4.5 hours, or I might be running a 10k, or I might just be on a very long walk, but they all affect me differently. So now I know how to prepare, how to adjust, and even though the course is quite sciencey, it kind of gave me the background knowledge that means I actually do things that I didn't think were important before, like always changing my needle, and I knew you were supposed to, but I didn't bother, and I never tested for ketones before, and various other things I do now because I understand the science behind it, and I think everybody else on the course did. We were quite a diverse group of people. There were about 7 of us, of all different backgrounds. There was a barrister on the course, and there was like a couple of pensioners as well. So we were all really different people, but we all, got not the same, obviously, because we all had different needs and whatever, but we all benefited so much from the course, and I certainly finish the course thinking, the diabetes hasn't got me, I've got diabetes, and it's a very different mindset. And in particular, the one thing that I feel I really benefited from was just spending all that time with other people who've got the same as me, type 1 diabetes, and going through the same problems, because I do feel that they do gloss over the mental health stuff, and it does affect you, and it's kind of swept under the carpet, but we got it all out in the open, and it was brilliant, and you just feel so much better. And in fact, we're carrying on meeting as a group. We go down the pub once a month, which is really nice. And the other thing that I'd like to say, it was also really good to get the chance to speak to the diabetes consultant on the course as well. So yeah, it was brilliant. It's one of the best things I've done, and I wish I could have been on it, many years ago when I was diagnosed, although I suppose it didn't exist then. Well, basically, I think if you've got diabetes, just go on the patient education course, soccer for type 1s, and the expert course for type 2s. And I know that the type 2 is equally well received to the soccer course that I've been on. And I think all clinicians should be referring their patients onto it, even just purely from saving money for the NHS, because the amount of money, and the evidence is there, I know, that shows the amount of money that can be saved from reducing appointment times, reducing prescriptions, and obviously reducing long-term complications. It's just a no-brainer. And I think if I was to say something to other diabetic patients, I would say just go on the course, you won't regret it.